Hello friends, welcome to gillfish nursing channel. Today we are going to discuss the OBG questions paper. Let's see the questions and answer. First question. Hydatiform mole is an abnormal condition affecting the A answer is chorion, B amnion, C villi, D blastomere. So usually hydatiform mole it's happen in chorionic villi. So the correct answer is chorion. Next question. What is the clinical features of hydatiform mole? So the answer A is snowstorm appearance in USG, B elevate level of HCG, and the C is absence of fetal part and FSH, and D is all of the above. So what is the correct answer? Usually for the hydatiform mole you will get snowstorm appearance, HCG is going to increase, and also absence of fetal heart rate. So the correct answer is all of above it is. Okay, now we'll move on to third question. Fetal organ of placenta is A 1/5 or B is 3/5 of the body weight and 2/5 of the body weight, and D is 4/5 of the body weight. So usually that what is the fetal organ of placenta is 4/5 of the body weight. So that is a correct answer. So a term approximate placental weight is, what is that? So A is 700 gram and B 500 gram and C 1200 gram and D 1700 gram. So what is the correct answer? Usually the placental weight is 1/6 of the body weight of the baby. So that means the correct answer will be the 500 grams. So that is the correct answer. And fifth question is, oral contraceptive pills need to be started on when? So the A is first day of menstruation, and B third day of menstruation, and C fifth day of menstruation, and D seventh day of menstruation. What is the correct answer? Can you guess it that? So usually you must be start the oral contraceptive pills so that first day of the menstruation. So that will be the correct answer. So the next sixth question is, the action of spermicidal agent is, so what is the answer? So first A prevent the motility of the sperm, and B kill sperm immediately, and C render the sperm immediately, and D prevent sperm for striking to the uterine wall. So usually that cidal, that means killing, that is the answer. Sperm means it is a sperm. So the correct answer is kill sperm immediately. So that is the correct answer. Short cord is then if the length of the umbilical cord is less than. So usually you know that it is the length of the cord is, so first A 10 centimeter and B 20 centimeter and C 35 centimeter or less, and D is 40 centimeter. So what is the length of the cord? That is a 50 centimeter, you know that. So if it is less than 35, so that is called it a short cord. That is a correct answer. And next question is, most commonly single umbilical artery is seen in. So you see the question, that is single umbilical artery. So in which condition you note it down. First A abruptio placenta, and B placenta previa, and C multiple birth, and D is battle tore placenta. So what is the correct answer here? That is a multiple birth only you will get single umbilical artery. So next question, that is ninth, umbilical vein, it's carry what type of the blood? So A oxygenated blood, and B deoxygenated blood, and C mixed blood, and D all above it is. So you know that it is always in the placenta umbilical vein and also in the pulmonary arteries they are going to carry the oxygenated blood it is. So that the correct answer is oxygenated blood. Next questions. The placenta is said to be retained when it is not expelled out within. So you will check it out. What is the correct answer? A 15 minutes and B 45 minutes and C 30 minutes and D 60 minutes. Can you guess the answer? What will be there? So usually the placenta will be expelled within 15 minutes. That is correct answer. If it is not expelled out that 30 minutes, so that means you should be precautions, you have to take it out. So the correct answer is 30 minutes. The next question is, what is duration of puerperium? So you know that it is puerperium means postpartum period. So what is the meaning? Postpartum period from the childbirth to up to the weeks it is. So you check it first. What is the A 10 weeks and the B 6 weeks, C 1 month and D will be the less than 28 days. So the correct answer is, you know that the postpartum period will be the 6 phase from the childbirth to up to the mother's reproductive organs return to the original state. That is called it as puerperium or postnatal period. Okay, we can move on to next question. So what is the vaginal pH during pregnancy is? The A acidic and the B will be the basic and C neutral and D will be the none of them. So you know that always vaginal pH will be, what is that answer? It will be the acidic in the nature. So that will be the correct answer. Then only there is no microorganism will be not enter into the vaginal area. So that is the correct answer, acidic. Okay, next question. So largest cell in the human body is, so what is the answer here? You know that A osteocyte and B ovum and C glial cell and D myelin cells. You know that this osteocyte, glial cell, myelin is all related to that. You know that related to the brain cells it is. But only answer is, the correct answer is ovum. That will be the female egg. It is also mostly largest cell in the human body. Okay. And which is the smallest cell? That will be the male spermatus. Okay, fine. Okay, next question. The normal vaginal pH during childbearing period is, so the A 6.8 and the B 5.9 and C 4.5 and D 7. So you know that already we have seen in the previous questions. So usually the vaginal pH will be in the acidic in the NHS. So neutral means it's above 7, it's neutral means 7, above 7 is alkaline and below 7 is acidic. So you might be the answer will be the 4.5 because always the vaginal pH will be 3.82 and 4.5. So that will be the correct answer, acidic in the natures it is. Okay, fine. That is during the childbearing. Okay, next question. So denominator in phase presentation. So the A acciput and B sacrum and C mentum and D frontal eminence. So you know that what do you mean by denominator? The which part of the body is present in the pelvic area. So for that it going to do the assessment. So that time. So if it is which part is going to be present, presenting part is called it as denominator. So here that usually for acciput means it is related to the head. If it is a sacrum, that is patex. So that means it is in the other presentation. That's okay. For the correct answer, you know that it is mentum. It is a correct answer for presentation of the face presentation. So occiput and frontal, it's most probably in the different conditions. Okay, fine. Then move on to another. Okay, fine. How we can estimate it? Expected date of delivery. You know that it is, so A first day of last menstrual cycle plus 280 days and B first day of last menstrual cycle plus 266 days and C ovulation day plus 280 days and D ovulation day plus 266 days. So I have one video I was posted that is related to Negley's rules, how should calculate the expected date of delivery. So what is the correct answer? So you must be calculated from the first day of last menstrual cycle plus 280 days. that is 9 months plus 7 days. You can check my previous video. I have posted already. It is there in that. You check it out. Okay, fine. Next, move on to another. The next questions. Duration of latent phase in primary gravida is about 4 hours, or next 6 hours, and C 8 hours, and D will be the 10 hours. The question is, you check it out, that is related to the primary gravida. So that is latent phase. So the correct answer is 8 hours. In the primary gravida, so most probably 8 hours. Okay, because it will begin with the onset of regular contraction and with the cervix dilatation. So most probably it was happen in the latent phase. So most probably the 8 hours. Okay, next question. Duration of latent phase in multipara is about how many hours? A 6 hours, and B will be 4 hours, and C will be 10 hours, and D will be 8 hours. So it is called it as, that is multipara. So in the primipara it is 8 hours. So that will be the primary gravida, it is 8 hours. Now the question is, you see, that is multipara. So the answer will be the, what will be the 4 hours. So because in latent phase will be shorter in multipara, so that it will be the duration is 4 hours, and it is begin with the onset of regular contraction, same time it is up to the 3 to 4 centimeter dilatations. Okay, fine. Okay, at last it is going to be, so what is that? Partograph was first devised it by A. Friedman, and D. Dr. A.L. Madeliar, and C. Dr. Schroeder, and D. Dr. William Shaw. So what is the correct answer? You know that it is photograph was first invented by, who will be there? That is Friedman. So that is a person is first discovered and designed by the photograph, and is improved by Flofort and Castell in the later. So the correct answer is Friedman. So that will be the correct answer. So thank you for watching.